Working with children is my passion. I wanted to do nursing, but tugging with kids, that's what took my heart. So, I mean, it's something that I love to do. I had a gallbladder surgery, I think in 2006, and they found out that I had an aneurysm. They sent me to a couple heart doctors that was in Tallahassee, and everybody was like they couldn't do surgery.
Hi, I'm Robert Feezor. I'm a vascular surgeon at UF Health. When I met Kraven, I met her in clinic. What I saw from outside, she looked normal, healthy, no symptoms, was in her usual state of health, but on her CT scan she had a very large aneurysm at the base of her aberrant right subclavian artery.
I mean, I was panicking because I have children, and when you hear the word aneurysm, it's like, I mean, something can happen that instant. Every day it was like, can this aneurysm rupture? When? How?
We thought that we could come up with a way to fix it minimally invasive with just a couple of incisions above her collarbones and then putting in a stent. The aneurysm is here and it's big, and you can see that if you were to do an endovascular stent, you'd have to land up here and encroach on the artery to her left arm, and you'd have to cover the artery to her right arm. And so our plan was to do a surgical bypass to this artery, the left and right subclavian arteries, and then come in and put a stent graft extending all the way up to here.
Well, when I arrived, I was a little nervous at the time, but that morning, when they prepped me, everybody was nice. Also, I had my family there. They did give them, I guess, every step of the way with my surgery, what was going on.
Kraven did remarkably well. I think she went home in about 4 days. And I've seen her back in clinic with follow-up CT scans. She looks great, and other than some very small incisions which have healed nicely, you'd never know she had surgery. The aneurysm's completely sealed, it's excluded, it looks perfect on CT scan, and she's doing great and went forward with her business at home.
Give me a change. Need a change. It's 50,000. Oh. My children is my life. Well, me and my family, we go on trips, exercise together sometimes, run, play. It's just like sometimes we at the house dancing around. So it's a big relief to me. I don't have to like hold back of different stuff of my everyday life that I'm trying to do.
One of the nice things about being a vascular surgeon is being able to take care of patients longitudinally. In fact, we always see patients forever and ever and ever, and it's nice because in the hospital patients look like patients, but then you see them post-operatively, and it's a reminder that they're real people with real lives, and especially with Kraven, because she was in her early 30s when I met her, and so she had a lot of the same stressors that I do as a parent and trying to manage work and family, and so to see her back to normal, having her aneurysm fixed, was really rewarding. The UF Health difference is really a team approach. It's everyone working together to take care of the patient in the best possible way. We have the ability to think outside the box a little bit and to do things that are a little bit uncommon, particularly things that with uncommon anatomies. And I think Kraven's a perfect example of that. She got a very sophisticated, elegant repair, in my opinion, did wonderfully with it, and I think it's a huge team victory.
I think after the surgery, I do have a relief that I'll be here to see my kids grow up, graduate from high school, and also have a family of their own.